I would say any person who is becoming a doctor, please stay in India. Why? The amount of patients we see, the amount of freedom what we have in treating the patients, we don't get it abroad. Fertility is the potential for any couple, a male and a female, their potential to get pregnant or to deliver the baby and to move forward the generation of the family, right? So that's fertility. So when a couple is not able to get pregnant, or when they are not able to be fertile and not able to deliver a baby or to procreate or to move forward with their family, it's known as infertility. So the interesting part about infertility is, if we all know WHO, that's the World Health Organization. So a few years back, WHO declared that infertility, in fact, is a disease. So disease is something which can be treatable. Till now, infertility was only considered as a social taboo. Okay, itne saal ho gaye hai, it's been so many years, why you're not getting pregnant? So now WHO has come out and said it's a disease which you can treat. So WHO says any couple who has tried without any protection for a year can be labeled as an infertile couple and needs the investigations or need the treatment from a specialist about why and how can they, the reason behind the infertility and what treatment do we have to give. So when a patient is pregnant, how you're going to treat them, how you're going to monitor her pregnancy, whether she's doing well or she's not doing well in terms of her anemia, hemoglobin, the baby's growth, her blood pressure, or whatever conditions what she's going to face at the time when she's going to be pregnant, followed by her delivery. After the delivery, again, your work doesn't stop there. It's the postpartum period, that's the post-delivery, that comes under you. Her breastfeeding, that comes under you. So that's the obstetric part, where we are dealing with anything which is related to pregnancy. Intra-pregnancy, that's the delivery part, normal delivery, C-section, whatever. Postpartum and her breastfeeding, and post that her contraception. So that's the obstetrics part. Gynecology, on the other hand, is something related to anything related to the female body. That could be your irregular periods, it could be certain vaginal infections, it could be abdominal pain, it could be people not having their periods on time. Like there are girls who don't get the periods at the proper age, so that's related to puberty. Let's say the adolescent, heavy bleeding. So this all comes under the gynecology. Okay, so when we train ourselves for that 3 years, we are training ourselves for this part of obstetrics and part of gynecology. Now, infertility is a part of gynecology because you are having certain problems with your hormones. Again, now, because of so many advent of different subjects, infertility or reproductive medicine has become a separate, super specialized job or a career for any gynecologist who want to pursue at a later part. So if I want to concentrate only on infertility and not concentrate on the OBGY, I can do my certain degrees followed after the OBGY, like we call it as fellowship in reproductive medicine. So it's again a 3 years course along with the DNB with the national boards, and there are MCH seats which are available for 2 years. So you can do the super specialization after your OBGY and you become a fertility specialist. Fertility specialist has to encounter everything related to male fertility and the female infertility. So you have to evaluate whatever parameters you have for the female as well as for the male. So anything related from the sperm production, sperm quality, not having intercourse, or any problems at the time of the sex comes under the fertility specialist. Female, again, irregular periods, not getting periods on time, scanty bleeding, not able to conceive, anything related to female part, that's the uterus, fallopian tubes, ovaries, comes under the fertility specialist. Okay, so the whole agenda of a fertility specialist is to guide you how you can become parents. With the proper guidance, you can achieve the parenthood maybe in a year's time. If we need something needs to be addressed at an emergency or at a faster level, we can do it. So you have to be a very tough person emotionally, because this is what you're going to do day in and out. When you deliver a pregnancy or when you deliver a baby, it's always the happy moment. The patient gets admitted, you do the surgery or you make them deliver normally, you have that baby in your hand and you're delivering that happiness to the couple who has come to you. So usually 99% of the time you're just delivering is the happiness. Here it's both. You are delivering the happiness, but as well as you have to be the person, or you have to be the messenger to give them that message that, your body failed this time, was not able to accept that baby. So person who is not emotionally weak can opt for this journey. If you like something which is a very specialized and a focused part, understanding the reproductive journey, it's a good option for you to, go ahead and do this reproductive medicine and plan the BA of fertility specialist. I would suggest it's a very good branch for girls or for the people who don't want to end up doing emergencies, because there are no usually emergencies. It's like a daycare. It's an elective procedure. So usually there are no emergencies out there unless some patient bleeds or some happens. Okay. But if you are doing just the general OBGY, the obstetrics, the baby can come at any time, 2 a.m., 3 a.m., 5 a.m., 6 p.m., anytime. So you can't plan your holidays, you can't plan your nights, you can't plan things that. So if you don't have a good team for OBGY, it becomes very difficult to manage. So if you're looking for someone who is more of a family person, who wants to balance career as well as family, I would suggest being a fertility specialist is a good option, because you get time to be with your kids, to be with your family, you can concentrate on your academics, you can do multiple things. And plus, it's a super specialized job. So you have that feeling of being something more than what an OBGY is. So yes, I think it belongs to someone who is strong, who can study so much, who can understand small details about the hormones, and who is smart enough to, or strong enough to handle any case. I would say any person who is becoming a doctor, please stay in India. Why? The amount of patients we see, the amount of freedom what we have in treating the patients, we don't get it abroad. So that is the reason when we finish our education from here and when we shift abroad, we get tremendous opportunity out there, because whatever number of patients you have seen with limited technology, with limited sources, because most of the time people may not be able to afford every investigation what is there. So you rely on your clinical judgment. So that is what makes you the better doctor. So even if you want to go abroad, don't go for your MBBS. Finish your MBBS, finish your post-graduation. Post that, probably if you want to go, you can go. But no, stay here, finish your graduation. I would even say finish your post-graduation if you're in the surgical field. The number of surgeries what we do in India is nowhere compared to abroad. So for doctors, yes, I think it's a brilliant idea to stay back here, and post your post-graduation, you can think about going outside. And amazing institutes now. We have got AIIMS, we have got so many institutes which have come in, and the government of India has progressed so much. There are so many medical colleges opening up every month now. So we have enough of institutes to go ahead and, we can learn about it. We have got enough of private corporate setups where you can join, you can have all those facilities which are available, or all those, technologies which are available abroad, and you can go ahead. And in fact, insurances have been so good now that most of the people can be treated with good care.